The second line of defense is going to involve elements of an organism's body that are deeper in tissues that will react when the first line of defense has been breached. The focus of this video will be to look at what are the organs, cells, common chemicals, and reactions that we can expect from the second line of defense. Let's get started. If you checked out the video on the first line of defense, you are familiar with the fact that I like to look for patterns, and that when I have thought about the second line of defense, I have tried to divide the various components of these lines of defenses into cells and organs, chemicals, and responses. Now, this system, the second line of defense, has more processes and more components to it than what we see in the first line of defense. So in this video, you can expect to learn about the key players. However, some of the processes and some of the events that happen in the second line of defense will be covered in other short videos, like the phagocytosis video. So our focus here is going to be to look at what are the key players, and then you should check out the third line of defense video to see the more complex component of these defense lines that help keep the human body safe. Now, as a reminder, the body is divided into innate and adaptive or non-specific and specific immune systems, and both the first and second lines of defenses are innate or non-specific, meaning these are things that the body is born with, and more importantly, that these are things that the body is going to use to respond, but in a very generalized fashion. So there's no memory, there's no specificity to it. Both the first and second line are there to just get rid of anything that may potentially be invading the host. All right, so when I think about the second line of defense, I like to use medieval examples to try to think about the level of training or the level of specificity that the second line of defense is going to have. And so when I think about that, I oftentimes think about the first line of defense as being the foot soldiers, those guys who are just sent run out, right? They're peasants we pulled out of the fields, and in medieval battles, we just sort of sent them out into the foyer, right? Maybe similarly, if you are a Tolkien fan and you are familiar with the Lord of the Rings series, the first line of defense are kind of like those foot soldiers, those ones that go running and charging out, but generally don't have necessarily a lot of training. They're just sort of out there as a first line. Now, our second line of defense has a little more specificity, a little more education behind it. Not even necessarily education, but certainly a little more training, a little more capability than a guy out on the field with a sword. So the second line of defense, I like to think of as the archers. This is going to be a more elite group that is sitting behind the first line of defense that's just going to shoot the arrows out towards the battlefield. Now, if you've ever watched a Lord of the Rings movie, or you've done any or had any interest in history, maybe you watched the movie Braveheart from the 90s, you know that when the archers loose their arrows, there's oftentimes collateral damage. So sometimes we see tissue damage happening, right? We hit our own cells, just like those archers hit their own guys, just to the same degree that they are potentially taking out the enemy. So let's think about the components of the second line of defense. All right, we're going to do the second line of defense in orange. And the first thing I'm going to do is highlight some organs that play key roles in the second line of defense. So our key organs are going to be structures like lymph nodes. We're also going to see key structures like the spleen. And we have found that patients that are missing their spleen or have a congenital absence of the spleen, meaning they were born without a spleen, that does actually happen, have an increased likelihood of getting sick, and then the prognosis for them is actually lower than a body that has a spleen. So the spleen is an important component of the immune system. There is another organ that plays a key role in helping protect things from entering the body, and this organ happens to be located in the back of the oral cavity and is going to help combat things that are coming in through the oral cavity. And of course, we eat daily, so this is an exposure that we expect to see fairly commonly. So that third organ that we're going to list up here as being important in helping with the second line of defense is the tonsils. And you may be familiar that sometimes tonsils stay inflamed. They're a little bit too active, and occasionally we do remove these from a patient if they are providing more harm than benefit. Okay, now cells. What are the cells that we're going to see that are key players to the second line of defense? There are cells embedded across the bodies that are called mast cells. And mast cells play an important role in the release of a chemical. That chemical is histamine. So I'm just going to throw histamine over here, kind of in the same line as the mast cells, because the mast cells are the things that release that histamine chemical. Okay, we're going to come back to our chemicals, but we need to continue with other important cells. Embedded in the epithelium of your tissues and the skin layer is a set of cells known as dendritic cells. These cells are in the surface of your skin looking for a microbe that might be trying to weasel its way down through the layers of your skin. And these dendritic cells can help identify them, capture them, and remove them before they're able to get any deeper and potentially cause an infection. We also have a series of cells known as reticular cells. Those cells are also going to contribute in sort of surveillance across the body and helping keep microbes out. And then we have two major groups. We have the macrophage. This guy is going to be so important to what we do to keep the body safe. This is sort of your roving security guard, able to move around and collect various things and remove it. I oftentimes think about this cell as a Pac-Man cell. In addition to the macrophage, we have a whole group of cells that are collectively known as white blood cells, WBCs. You might also hear these referred to as a leukocyte, which is a clinical term for the white blood cells. Most people in common language know of them as white blood cells. Leukocytes is a synonymous term. It means the same thing. There are 5 types of white blood cells that we're going to investigate. We're going to look at neutrophils. We'll have a video to support you in this. Lymphocytes. And with the lymphocytes, we're going to put in parentheses because when we're talking about the immune system, the lymphocytes are a key player in the immune system. And there are some lymphocytes, we're born with them. They come from our bone marrow. But there are some that work wholly in this second line of defense. And then there are some that are going to specialize. So we're going to put NK up here, NK, for a natural killer cell. And you're going to see me illustrate this in the same orange color to remind you that this is part of our second line of defense. But in addition to T cells, we're also going to, in addition to natural killer cells, we're also going to have T cells and we're going to have B cells. And I'm going to illustrate those in blue just as a note that while they are here under our second line of defense, because you are born with these, your bone marrow creates them, these are the ones that are going to get to become specialized and are going to contribute to the third line of defense. So when we get to our third line of defense video, you'll see all the colors in blue because I like color coding. All right, lymphocytes. We'll talk more about what they do. And there is a video, the cell-mediated response video. There's a second video called the humoral response, independent humoral response. And those will help you better understand what the lymphocytes are doing in the way of coordinating immunity. All right, and 3 more white blood cells that we see. We have the monocyte. This guy turns into a macrophage. We have the eosinophil. I'm running out of board. And we also have the 5th one is the basophil. So each of these contribute to the system and play very specific roles in helping keep the immune system safe. So we'll investigate those more heavily in what their jobs and their functions are to help you better understand how the second line of defense is mounting a more aggressive response to a pathogen because that pathogen's already evaded the first line of defense and has been able to get internal to the body. Whew. All right, chemicals. We already have one chemical up here on the board, and that chemical is histamine. Histamine is produced by the mast cells, which is a critical component of then a response that we'll look at in a hot minute here. We also see some other chemicals that are released. One of them is called pyrogens. Pyrogen is a throwback to fire. So these are very specific chemicals that are going to assist the body in producing fever-like states. Fevers are important to the body because this is going to elevate the overall temperature. You've probably learned that enzymes function at very specific temperatures. So if we can increase the temperature, then perhaps we can push the microbe out of its ideal growth range and potentially interfere with its growth, interfere with its enzyme production or enzyme functioning, and potentially help kill that microbe. Another chemical that we see in the body is transferrin. Furin is a reference to iron. And this is a critical component that we see circulating in the blood to help capture iron and carry iron from, for example, the liver over to the bone marrow. So free iron in the blood is not necessarily a good idea, and there are a number of microbes that like to use iron as a component of how they grow. It would help them grow better in the blood, which is a place we never want to see microbes growing. And so transferrin is a body adaptation to help make sure that free iron is bound to this molecule. It transfers it from location to location and tries to prevent microbes from having access to it. There are 3 more chemicals we're going to look at. One of them is known as interferon. Interferon is specifically a molecule that signals other cells that there's a virus around. We do utilize this in therapy, so we have the ability to give patients with viral infections doses of interferon. This is to try to boost the second line of defense and help against the microbe, but it isn't specific to any particular virus. It's just a generalized effect for viruses. We have another protein-produced chemical that is called complement. It was named because it complements the third line of defense. In fact, the first discovery of complement was associated with discovering of a reaction that this protein did to help our third line of defense. We've now subsequently discovered complement does a whole bunch of things all on its own, doesn't involve the third line of defense all the time, but the name stuck, so we still call it complement. And complement's going to be more useful to us to attack things like bacteria and other cells that are not supposed to be in the body. And the 5th chemical that we're going to talk about is something called an interleukin. Now, the interleukin will be discussed in more detail in the cell-mediated response and humoral videos, so check those out if you're looking for more information. But this is basically a signaling molecule. And this is important because interleukins are going to be the way that the white blood cells communicate. So remember, white blood cells were also called leukocytes. All 5 of these are called leukocytes or white blood cells. And interleukin is the chemical. Interleukin is the signal that those white blood cells are using. So chemicals specific to communicating white blood cells, a chemical specifically coming from a mast cell. And now we want to think about what responses we have. So in the first line of defense, remember we talked about things that are going to blow things out or wash things away. But in the case of the second line of defense, now this pathogen, this microbe, has been able to get internal to the body. And because it's gone internal to the body, now we need to figure out how to get it out of the tissues. How do we protect the body when it's in the tissues? I've tried to actually line some of these up to be able to line up directly with how the cells and the chemicals that they're releasing are going to contribute to the responses that we're seeing here. So the first response, and one we mentioned already, is fever. Recall, fever is, the goal of fever is to push microbes outside of their comfortable temperature ranges in an attempt to make sure that their enzymes become non-functional. That helps slow down the rate of growth of the microbe in the body and perhaps gives the immune system the upper hand. Another component or another thing that we see as an effect happening from the chemicals and the cells that are producing them is inflammation. And I'm going to write inflammation here because, yet again, histamine is actually the thing that signals for the response of inflammation. And inflammation has 4 basic components to it. You get redness, you get swelling, you get heat, and you also get a little bit of pain. So we'll talk about that independently of this video, but what is that process of inflammation? For complement is going to involve itself in a handful of things. So one of the things we're going to put up here is phagocytosis. And phagocytosis, gotta get our spelling right. Okay, phagocytosis is the process by which a foreign molecule is consumed and eaten and broken down into particles that are not as dangerous. We do have a video on phagocytosis, so check that one out to look at how that is happening. We also want to mark cells that are pathogenic or even cancer cells for removal from the body. And to do this, we use something called opsonization. Opsonization is a way to mark things for removal. My favorite example, because I live in an area where logging is common, is to mention that sometimes a crew will go into a forest and they will mark trees with spray paint. And those trees are being marked for removal. Perhaps they're diseased, maybe they're too little, maybe they're crowding out another tree, maybe those are just the trees that we want to harvest. And then after they've been opsonized, after they've been marked for removal, that's when a follow-up crew comes in and cuts down those trees. So the response of opsonization is really to just try to get other cells in the body to know what needs to be removed, something that's sort of been marked for removal from the body. The last one we're going to write up here is a process called immune clearance. Immune clearance involves red blood cells carrying structures, carrying microbes to the spleen, which is why the spleen is important to us. And the spleen is then going to take that microbe off, and the spleen is packed with a bunch of macrophages, and so they're able to remove this molecule that the red blood cell essentially delivered to the spleen. So that's another response that we see common of the second line of defense. Okay, so complement. Complement is going to be involved in phagocytosis. Complement is going to be involved in opsonization, and complement is going to be involved in immune clearance, as well as complement is involved in inflammation. So in a video on complement, we will further investigate the concepts of how complement is creating so many of these responses simultaneously. All right, key ideas for the second line of defense. Just like the first line of defense, the second line of defense can be divided into a pattern where there are cells and organs that help protect, chemicals that are used to have effects or to signal, and responses to help remove a microbe that has managed to get across the first line of defense and is essentially at this point in that donut analogy in the cake part of your body, in the center of your body. For organs, it's important to note 3 structures that play crucial roles in helping trap microbes. That's going to involve the lymph nodes, tonsils in the oral cavity, because so many bacteria come through that area, and the spleen as a critical organ. We note that the spleen does have a very important role in helping protect against getting sick and helping a patient overcome an illness if it's microbial caused. We have a whole list of cells that are going to play a role for the second line of defense. Very important to us, and what we will see engaged very frequently are the mast cells in an inflammation response through the signaling with histamine. Macrophages being these big Pac-Man cells, this constant security guard roving the body to try to remove microbes, as well as damaged cells, and then a whole cohort of leukocytes or white blood cells that are going to play very specific roles in helping protect the body and remove microbes that don't belong. We have a number of signaling chemicals. Perhaps those most interesting to you would be pyrogens, these chemicals that promote fever as a response, the histamine creating the inflammation reaction. This idea of interferon, which I like to joke is interfere with a viron, because this particular chemical protein that is produced is going to largely target viruses and help communicate about cells in a tissue that there is a virus in the area. Complement which is another protein produced by the liver that is going to help protect us against bacteria and other foreign invaders. This is perhaps the one chemical that has the most broad-reaching effect, as it's able to cause the responses of phagocytosis, inflammation, opsonization, and immune clearance. And lastly, interleukins, which we will discuss in greater detail in the third line of defense. Each T cell and B cell has its own form of interleukin, its own language that it uses to communicate. One last point, if you're looking at this in summary, is that under lymphocytes, under the cells and organs, you'll see lymphocytes and in parentheses, NK, T cells, and B cells. And you'll note that both the T cell and the B cell is in a different color. And that was intentionally because the T cells and the B cells, while we're born with them, while they are part of our second line of defense, part of these lymphocytes, become the key players for our third line of defense. And you should check out that video too. I hope you have a great day. Cheers. And you should check out that video too. I hope you have a great day. Cheers.